us once she's available. We'll call to order at 8:32 the January 10th meeting of the Public Safety Commission. Can we go ahead and get a roll call, please?
Commissioner Kang.
Here.
Commissioner Donnelly. Commissioner Watson.
Here.
Commissioner Angelatz. Vice Chair Kao.
Here.
Chair El-Sarraf.
Okay.
Commissioner Ding.
Here.
Okay.
We've got a
Yeah.
quorum.
Thank you. Do we have any public comments?
There are no general public comments.
Okay, can we go ahead and move on? We've got item number 2, the minutes of the Public Safety Commission meeting of December 13, 2021. Has everybody had a chance to review, and are there any proposed modifications? If not, does anybody have a motion to adopt those minutes?
I motion to adopt the minutes.
I second.
Let's go ahead and do a roll call vote as we're meeting virtually.
Commissioner Kang.
Yes.
Commissioner Watson.
Yes.
Commissioner Ding.
Yes.
Vice Chair Kao.
I'm going to abstain as I missed that meeting. But we've got a majority, so I think those are going to be adopted. So let's move on to item number 3, which is an update on potential new ordinance for the South Pasadena Municipal Code regarding prohibiting the sale of all tobacco products. Do we have a staff report?
We do, Commissioners. Good morning. How is everyone today? I hope you're doing well and Happy New Year. I'm here to introduce the continued discussion on a potential new ordinance banning the sale of all tobacco products in the city of South Pasadena. So as you saw in the staff report, we are going to have a little bit of a continued discussion today, and then also provide a recommendation to the City Council regarding whether or not the Commission endorses the attached draft ordinance as written. It looks like Commissioner Angelatz just joined us. Welcome. So as you know, at the October 18th, 2021 Public Safety Commission special meeting, staff introduced a framework for discussion on exploring and developing a policy to ban the sale of tobacco products within the city of South Pasadena. The commission reviewed a number of documents, took public comment, and held discussion on the item, putting together a set of recommendations for an initial draft ordinance to be presented to the City Council at a future date. Initial recommendations from the commission included seeking a ban on all tobacco products, not just flavored tobacco, potentially allowing hardship exemptions, again, potentially only for small businesses, prevention of new business or tobacco permit issuance, and whether or not to develop a hardship exemption eligibility on measurable quantitative factors such as percentage of overall sales. Since that meeting, the city attorney has provided guidance and made updates to the draft ordinance, which does incorporate many of the Public Safety Commission's recommendations for a potential ban of the sale of tobacco products, including a structure for the hardship exemption process. As you saw attached in your packet, attachment A is the updated draft ordinance, which includes the city attorney's recommendations for this draft ordinance. You'll also see that he made the formal changes to, I believe it's section 18 of the municipal code, which would further, what's the word I'm looking for? It would further show what changes need to be made to our municipal code as it currently stands. Just a couple other really quick updates. Since the October 18th special meeting, we did have a couple updates in terms of business mitigation and public outreach. For business mitigation, we did have a member from Pasadena City College's Small Business Development Center provide a presentation at the chamber. The chamber has let me know that the video from that meeting will be updated on their website in the very near future. And as you saw in our packet for today's meeting, the business flyer for that organization was included in case any businesses who weren't able to attend that presentation were interested in potentially using the services of the SBDC. Staff conducted an additional outreach for this meeting, including in-person, mailed, and emailed, with an update provided once we had direction to only hold this meeting remotely. A couple key provisions of the updated ordinance. Basically, the overall gist of the ordinance is that it shall make it unlawful for retailers to sell any tobacco product in the city. And the carve out for the cigar shop remains in this draft ordinance today. It also establishes an effective date of September 15th, 2022. And this was put in place based on the city attorney's review of the current permits issued within the city. So he took into consideration when the last current permit would be expiring, and then an implementation date of September 15th, 2022 would then make it so that the ban could go into place with an implementation date of September, and then the outlawing after that date. So that's it for my updates, unless the chief has anything he would like to add.
No, nothing further from me.
Sure. So I do see the city attorney on here. Let's see, Mr. Jared, good morning. Is there anything that you would like to add, or would you like to just remain available for questions from the commission?
Good morning. No, Allison, I think that was a fine outline of everything. I think the trickiest part here is the implementation date versus the effective date. And a lot of times folks think of an ordinance and they think of an effective date. Well, this ordinance is a bit complex in that it is amending a provision dealing with permitting. And so if we were to have the effective date of the ordinance itself, all the words on the page, out, say, a year, well, then there would be an opportunity for someone to seek a permit immediately. And so what we're trying to do here is shut down the permit process while at the same time not crack down on sales immediately. That will allow then the retailers to sell down their current stock and no new retailers come in. So that's what we're shooting for here. I think we've achieved it. And so as Allison said, we looked at the data available for permits ending, and those in-permit dates as we currently see them will be September 14th, I believe, which then would mean the implementation date becomes September 15th.
Okay, thank you for the informative report, Ms. Worrell, and the background information, Mr. Jared. Before we see if there are any public comments, do any commissioners have questions for staff? Doesn't, oh, go ahead, Commissioner Angelatz.
One question I have is, between the time we last discussed this and now, have any other municipalities implemented similar ordinances? Specifically, I guess in California, that's more narrow.
From our research, I don't believe we've come across any additional municipalities that have initiated a total ban. I can't think of the exact cities offhand, but some have looked at either flavored tobacco or vaping products. But as far as I know, there have not been any additional total bans.
Thank you.
I have a question. In the last meeting, I missed the last meeting, but the meeting before was when this came up. I think one of the key things the commission wanted considered was to essentially have all existing businesses be grandfathered in on pretty much an indefinite basis. I thought that was not implemented in the revised ordinance. Were there legal issues with that, or just overriding guidance on that?
I don't believe that there would be any true legal issues for keeping a status quo number of permits. But the direction provided that I heard was to eliminate tobacco sales citywide, with the exception of the cigar lounge. And so that's what we've tried to achieve here.
Okay.
I know there was also discussion on behalf of the commission in the previous meeting of possibly only offering hardship exemptions to smaller businesses. And as you may have noticed, that was also not included in this draft ordinance. I don't know if Mr. Jared would like to elaborate on that, but that was one area.
I think the commission actually decided not to do that because it would be, well, I think the commission ultimately decided not to go down that road because it would be too hard to figure out what's small, what's not, and all that. So I don't think that was actually ended up on the motion.
Well, we did evaluate the issue of whether or not we could call it a small business or a business with 50 employees or less. And upon evaluation of it, it really is a tricky situation there of just because an employer has some number of employees, would they really have a hardship? And so to draw a very clear line on that issue based on number of employees, and given the margins and given the type of industry we're in here, we evaluated it and said, you know, why don't we just leave it as hardship period? And so if an entity sees this as being a hardship, that it is going to close them down, and we were taking, you know, all use of their property, not just a regulatory taking, but all use of their property, well, then they can spell it out. And then there's a process for determining an amortization rate for which they can, you know, we can regulate the use. And so that's what that process is about. So there still is the process of allowing hardship, but it's just not specified as to small business or number of employees.
And it looks like it's maximum of 1 year, one time. Is that correct?
I think there probably is a possibility for a hearing officer to go longer than that. But given the types of product we're talking about, and given the inventories and the uses in particular in South Pasadena, I do not see it going beyond that.
Yeah, so it looks like, just for anyone watching, it looks like it's primarily it's primarily in place to sell off existing inventory, not to necessarily address any ongoing financial hardship that they may have as far as just continuing to sell product. It's really just like, get rid of what you have on hand, and the shelf life of cigarettes probably will not expand. I mean, I don't smoke, but I would assume that after a year, they probably start getting stale or whatnot.
Correct. I think you've hit on a key point there. If I'm in a business that is going under anyway, I can't claim hardship exemption and say, well, my business is failing, and then you slap this on top of me as well. No, that's not the way it works. The hardship exemption is about this regulation causes the hardship. And so this is an economy, this is an industry that is slowly going away on its own, historically. And the city's goal is to address the health effects of this product and hurry along its obsolescence. And so the hardship exemption is, are we going about that in such a way that it takes all economic viability of the business away in an unreasonable manner. And so,
Thank you.
like you said, the products will on their own be going stale, literally. And so it offers an opportunity to stop selling those products and then address what is a reasonable time frame to sell off the remaining stock of these products that we're seeing has no social utility.
I had a quick question just regarding if there's been any kind of updates as to whether municipalities who have prohibited the sales of tobacco products have been faced with legal challenge, and if so, whether there have been any kind of final judicial action on those challenges.
As far as we know, again, there have been no additional municipalities since our last meeting, but Beverly Hills and Manhattan Beach both had their ordinances go into effect. I believe that with Beverly Hills, they've had, I believe they've conducted 2 hearing officer appeals. I believe one is still in process and the other has been finalized in terms of a legal appeal or something filed in the courts. I don't believe they've seen anything, and I don't believe Manhattan Beach has either.
And I know of no additional legal challenges.
Okay, great, thanks. Unless we've got any other questions by the commissioners, we'll go ahead and see if there's any public comment on this item.
I see we do have several attendees, and it looks like some have marked their hands as raised. If we could have anyone who's interested in giving public comment, please raise your hand on Zoom so that we will know to call on you. That would be great. Chair, would we like to move forward with Vice Chair, would we like to move forward with public comment?
Yes, please.
Great. Let's start. We'll just go in order in terms of hands raised. Christina Cardenas.
Good morning, commissioners. My name is Cristina Cardenas. I'm a program manager for LAC USC Medical Center Foundation that is working with the Breathe Free South Pasadena Coalition. This coalition has been meeting for now 3 years in the city of South Pasadena with parents, youth on the consequences and dangers of tobacco, as well as educating and informing communities across California on the consequences of those actions and opportunities for positive change. We have learned that from the U.S. Surgeon General that vaping has been deemed an epidemic and has impacting communities across the United States and the world, including South Pasadena, for anyone with contact to secondhand smoke and its effects affecting students across South Pasadena, regardless of race, income, gender, and if they're actually smoking or not. We've had the opportunity to collaborate with the South Pasadena Senior Center, the Teen Center, Parks and Recreation, the YMCA, South Pasadena High School, South Pasadena PTSA, South Pasadena Unified School District, and the South Pasadena Chamber of Commerce to meet with students and residents over the last 2.5 years to talk about this issue in public spaces, including concerts in the park, farmers market, and various presentations held by students for students to discuss viable options for change. We have in turn been able to collect community-based data with regards to the availability and sale of tobacco in South Pasadena. What we have learned is through a survey called a Youth Adult Purchase Survey conducted in July 2019 through December 2019, we learned that 1 in 5 stores in the city of South Pasadena were willing to sell tobacco products to young adults. The legal tobacco age is 21, and we had youth by the age of 19 and 20 enter stores and conduct attempted purchases. The YAPs allowed us to understand the climate of sales in the city of South Pasadena. And we did learn that many youth who looked older, perceived as older, store owners and managers were willing to sell to those particular students. In sum, we are here today to serve as a resource. Our coalition are here today, members of our coalition, as well as statewide partners who have interfaced with communities that have adopted policies to ban the sale of tobacco. And we'd love to serve as a resource as the city moves forward in understanding kind of any sort of issues with implementation, and serve as a resource for future education and implementation within the city of South Pasadena. We've had the honor of attending local events, and we have had the honor of being able to speak to residents and youth about some misconceptions around vaping and tobacco. And we continue to, we're going to be continuing to work with the South Pasadena School District to implement future education around the issue to support with the policy. So we just want to thank you for your time and consideration of item 3 that we are in full support of. Thank you.
Thank you. Next, we have Myron Dean Kwan.
All right, good morning, Honorable Public Safety Commissioners. I'm Myron Kwan, a resident in Garfield Park. My family's lived here for 6 years. Our 2 boys attend Monterey Hills Elementary. I'm also the child of immigrant parents who ran a small mom and pop grocery store for 4 decades. And regardless, I definitely support this ordinance. Item number 3. In 2022, and with this ongoing pandemic, it's very clear that South Pass has no legitimate reason to allow the sales of any tobacco products, including vaping devices. The chemicals from smoking and vaping harm everyone. Doesn't matter if it's directly inhaled or a secondhand smoke or even third-hand smoke. Our young residents remain at high risk due to addiction. And especially right now with our Omicron surge, once again, we see increased mental health needs for our young folks as they enter school today after a long break. And the best thing we can do to support them is to eliminate another preventable harm to our young folks. I'm very active with other parents in Monterey Hills. I'm active at the local Y. Literally every single person I speak to think this is a no-brainer and that we should support this ordinance. So I'm just sharing that as my sort of non-scientific conversation with South Pass residents. I've been very active with this local coalition. And so again, the residents and businesses have all shown up to say, yeah, this is a great ordinance. Let's move forward, shall we? Although not everyone can attend today's session, we're back in real life, sort of. I can freely share that it's a very clear, we have majority support, and we have considered the impacts on small businesses. It's not like we don't have a diversity of viewpoint within. It's just that this is a very clear ordinance that we all can support. So therefore, we ask that the safety commissioners also try to support this ordinance unanimously and bring it to the city council where they can also move forward. Without a doubt, your actions can definitely save lives. Thank you very much.
Great. Next, we have Primo Castro.
Great. Thank you very much. Good morning. Primo Castro, Government Relations Director with the American Cancer Society Cancer Action Network, relating to hardship exemptions, allows restaurants, bars, and other hospitality businesses to obtain a waiver from complying with a smoke-free law because doing so supposedly causes them economic harm. These exemptions should be avoided because they create an unwarranted loophole, establish a favored class of businesses, and can lead to inconsistent application of the law. In addition, these provisions are based on the false premise that smoke-free laws have a negative economic impact on restaurants, bars, and other businesses. Peer-reviewed studies that examine objective measures such as sales tax receipts and unemployment levels have consistently found that this is not the case. If policymakers insist on a hardship exemptions, you can limit the resulting damage by requiring applicants for this exemption to demonstrate that they actually experience economic hardship. They should document this by providing sales tax receipts. Applicants should also be required to demonstrate that the significant economic hardship they experience was caused by the smoke-free law and not by other factors such as poor business practices, seasonal business fluctuations, or a broad trend in the particular business sector. Finally, hardship exemptions should only be valid for a limited period of time, no more than a year, and should not be renewable. Hopefully this helps. so everything that the commission is considering this morning, item number 3, we hope that you pass a comprehensive ordinance that will include all the above and make sure that, just know that we are here in support. Thank you.
Great, thank you. Next, we have Julia Rueda.
Good morning, members of the Public Safety Commission. My name is Julia Ruedas. I'm a policy analyst for LAC USC Medical Center Foundation, serving as a community engagement coordinator on the subcontract of the Los Angeles County Department of Public Health Tobacco Control and Prevention Program. We're excited to join virtually this morning. Our coalition members have been focused on educating and also informing the community of South Pasadena on the health impacts from the use of flavored tobacco. But part of their strategy has been to create education opportunities throughout the community and also programs to improve awareness about the dangers of addiction and to decrease youth vaping. Parents, community members, and the youth have expressed their concerns on the rising numbers of youth using vaping products and the misinformation which plays down that severity of vaping and the detrimental health effects it has. We are here this morning to be a resource in regards to item number 3 of today's agenda, the potential new ordinance for the South Pasadena Municipal Code regarding prohibiting the sale of all tobacco products. We are here to provide answers to any questions with regarding to community-based efforts and concerns about vaping that has been deemed an epidemic by the U.S. Surgeon General. California youth tobacco usage is increasing, where 1 in 10 LA County high school students say they are current e-cigarette users. Our efforts have allowed us to connect with public health experts across the state, and some of which have joined this morning to learn from best practices and model ordinances to address flavored tobacco. We appreciate your time this morning. We are thankful to staff and grateful for the opportunity to coordinate resources from the Department of Public Health and Public Health Law Center with staff in preparation for this potential new ordinance. Also, please know that given to school, the Breathe Free South Pasadena Youth Coalition members were not able to attend, but they've provided written statements to share with you their specific concerns and perspectives about vaping in their community. Thank you for your time and for your consideration.
Great, thank you. Next, we have Malone R.
Hi, I'm Malone. I'm a emeritus professor of nursing and health policy at University of California, San Francisco, and I'm just on to provide some background information for the commission. I sent some to the last meeting, but I just thought for the audience watching, it may be of interest because this is an area where we've done some work and we were involved with the Beverly Hills and Manhattan Beach ordinances in terms of providing background information. It's important to understand that even though we take for granted that these are products that have been sold widely and are sold widely everywhere, this what we face in terms of the tobacco pandemic is really a product of the 20th century. And it was not until the widespread commercialization of the cigarette that we got these levels of disease and addiction. The cigarette really is the most deadly consumer product in history, something that the industry knew for decades and worked to cover up. So one thing that is also important to understand is that California now has the second lowest smoking prevalence of any state in the country. And therefore, and certainly South Pasadena probably has a very low prevalence as well, having instituted a lot of excellent tobacco control measures. So this is not something where people are going to be making a lot of money on these products. It really is a conversation happening worldwide as to how we begin to phase out the sale of these products. And so just important to kind of understand that there is a larger context within which all of this is happening, and that many jurisdictions are beginning to have this conversation, particularly here in California, but internationally as well. And thank you for considering these comments.
Great. It looks like we only have one additional speaker looking to speak today, unless anyone else would like to raise their hands. But please move forward, Corinne van Groningen.
Hi, thanks for having me. My name is Dr. Corinne van Groningen. I'm a pediatrician in LA County and member of our local American Academy of Pediatrics chapter. And with my other colleagues, I am in support of this new ordinance to prohibit the sale of all tobacco products. So the evidence is clear that tobacco products are detrimental to the health and well-being of children and adolescents. Tobacco smoke exposure harms children from conception onward, either causing or exacerbating the risk of preterm birth, congenital malformations, stillbirth, sudden infant death, childhood obesity, behavior problems, neurocognitive defects, more severe asthma, bronchiolitis, pneumonia, middle ear infections, and cancer. According to a 2014 US Surgeon General's report, if we continue on our current trajectory, 5.6 million children alive today who are younger than 18 years of age will die prematurely as a result of smoking. Accessibility to tobacco products harms adolescents. A 2012 Surgeon General's report found that nearly 90% of tobacco-dependent adults initiated their tobacco use well before their 18th birthday. And moreover, nicotine has been documented to be detrimental to the developing brains of children and adolescents. No amount of tobacco is safe tobacco. And that's why this total ban on all sales of tobacco products is something that would help our pediatric patients, our communities, and I'm in full support of it. Thank you so much for letting me speak this morning.
Great, thank you. It looks like that is all the speakers we have here to speak live. We did receive some written public comment. I believe Laura has set up some audio for that. Laura, if you'd like to.
Yes, let me set it up.
Thank you.
The city of South Pasadena is like potentially going to do a ban on all tobacco sales. Yeah, Manhattan.
Laura, I think you need to unmute so that we're able to hear the public comments.
Public comment agenda item number 3. Hello. As a small business owner in the city of South Pasadena, we object and oppose the tobacco ban for our city. Tobacco is not a Class A drug or a gun. There is no reason why tobacco should be banned. We are lucky to have some of the greatest and smartest citizens in our city, and they are more than capable of making the right decision for themselves if tobacco is right for them or not. That is not the city's job to do for them. Most importantly, our city is surrounded by many small cities that still have not taken any type of ban. If we ban it in our city, customers and citizens will just travel a few miles and get it. At that point, the only loser will be the city and its citizens. Why should other cities take our tax dollars? This is a meaningless proposition. Our city's efforts should be set aside for better productivity. Thank you. Veer Management Company, Inc. Hello, my name is Chad Farah and I'm the owner of Ocean Liquor at 2005 Huntington Drive. I have owned Ocean Liquor since 2008. I wanted to show you this map that I have attached of all the tobacco retailers I found neighboring our city. Assuming a smoker lives in the middle of our 3.4 square mile city, I have written the miles it would take to travel to each destination from the middle of our city if this ban is in place. Although the majority of South Pasadena residents live near the border, I wanted to show you how close these tobacco retailers are from the furthest point of our borders. With all due respect, these retailers are walking distance. This ban will do nothing to deter anyone from smoking. Most residents work outside the city. They will patronize tobacco retailers in the city where they work or in the cities traveling to and from work. The city will be throwing away all the tobacco tax revenue for nothing. And if your concern is underage smoking, I highly doubt that there are any retailers in the city selling to minors. What are the stats? When was the last time a tobacco retailer in the city got caught selling to a minor? How many minors have been caught smoking by South Pasadena Police Department? Are there any public complaints from the residents about tobacco retailers selling to minors? Chad Farah, Ocean Liquor. The 6th of October 2021, dear representatives of the city of South Pasadena, we represent the foremost liquor market located at 301 Monterey Road, South Pasadena. We would like to express that we are against the ordinance proposed to prohibit the sale of all tobacco within the city for the following reasons. 1. If we no longer are able to sell tobacco products, we will lose business and our regular customers will instead go to neighboring cities. 2. By simply prohibiting the sale of tobacco in South Pasadena, we will not stop the root issue of smoking. People will still buy cigarettes and still smoke because cigarettes would still be accessible just a few blocks away in neighboring cities in all 4 directions. 3. People who purchase cigarettes also buy other items, such as sodas or chips. Because of this, we would lose significant revenue if tobacco were prohibited and may have to close our business, which has been in South Pasadena for decades. As we have described, this ordinance would adversely affect our business, inconvenience our customers significantly, and have absolutely no effect on health outcomes. We hope you consider these points in your decision. Thank you very much for your time. Sincerely, Foremost Liquor Market South, Pasadena, California. Honorable Mayor and members of the City Council, my name is Julianna Fong and I currently serve as the chair of the South Pasadena Youth Commission. In that position, I've had the opportunity to speak with Councilwoman Namer about the problem of teens in our city using tobacco products, including vaping. I share her concern about local businesses selling these products to minors because I've seen my classmates in high school vaping and smoking cigarettes. Even though businesses cannot legally sell tobacco products to persons under the age of 21, we all know that this law is not always enforced. This is why I strongly support the proposed ordinance that would prohibit the sale of all tobacco products in the city of South Pasadena. Thank you. Julianna Fong. Statement re. Negative effects upon the city of South Pasadena of having smoking and vaping materials for sale, readily available to youth and adults. My name is Judith M Harris, LCSW. I have been part of the South Pasadena community for the past 30 years. I raised a child who matriculated through all levels of South Pasadena public schools and have been integrally involved with both the school and city communities over years. I am a mental health professional with both a private psychotherapy practice servicing children, adolescents, and adults, and a private organizational consulting practice focused upon employee and organizational mental health and wellness, an area in which I have acquired much expertise, and which is key to personal, workplace, and community wellness is that of combating addiction and substance use of all kinds. I have routinely taken many trainings covering the span of addictive and substance use disorders over years and have worked with scores of clients who present with a range of these disorders. Since 2019, I have taken a centration of substance use training sponsored by UCLA School of Public Health, University of San Francisco, and the state of CA regarding smoking cessation. The use of combustible as well as vaping smoking materials is posing increased threats to the health and mental health of all populations in our state and country, but especially to youth. Vaping materials have been manufactured to target youth and are many times more toxic and dangerous to all who use them, but especially to youth since many times the amount of nicotine, a neurotoxin, and other toxic chemicals and metals particles are delivered to the developing brain and body through vaping mechanisms. Youth, whose brains are in the process of developing, are placed at high risk for developing mental health and other health issues as a result of vaping and smoking. Judith M Harris, MA, MSW, licensed clinical social worker. July 12, 2021. Subject: Breathe Free South Pasadena Coalition Support Letter. Dear South Pasadena City Council, I am writing to express my support of the Breathe Free South Pasadena Coalition in their efforts to protect the health and well-being of the youth residents in South Pasadena. This coalition consists of engaged parents and professionals that seek to prevent tobacco-related disease and death for youth. My office has met with the parent and student coalitions to listen to their advocacy on the damaging impacts of tobacco products on the adolescent brain. The health of the youth is an utmost priority to our present and future. The science and research on the harms of flavored tobacco products to the youth are alarming. As state senator, I am committed to efforts and policies that prioritize youth health, physical and mental well-being. I voted in favor of the legislature's policies in SB 793 to protect youth from tobacco products. While the state continues efforts to further protect and educate the youth on the damage of tobacco-related products, the cooperation and implementation of local governments is essential. Therefore, I strongly support the coalition's local efforts in raising awareness to this issue. I encourage the Council's support in further evaluating and implementing local measures to protect the youth and promote well-being. Should you have any questions, please feel free to contact my staff via phone at 818-409-0400 or via email at david.kim@sen.ca.gov. Thank you for your consideration. Anthony J. Portantino, State Senator, District 25. Rosa Soto, Executive Director, the Wellness Center. Dear Executive Director Soto, as the Assembly member representing the 41st Assembly District, I write in support of finding solutions for the youth and residents in the city of South Pasadena to have opportunities to live in a healthy breathing environment. I support the Breathe Free South Pasadena Coalition and their public health efforts to prevent tobacco-related disease and death and the growing epidemic of youth tobacco use initiation driven by flavored tobacco products. These products contain nicotine and can have damaging impacts on the adolescent brain and cause long-term addiction. Smoking continues to be the leading preventable cause of death in the United States. The dangers of smoking is well documented by the Surgeon General, who has concluded that smoking causes cancer, respiratory and heart diseases, and birth defects. My work in Sacramento has allowed the opportunity to pass legislation, Assembly Bill 1696 of 2016, which provided the necessary resources in assisting individuals to secede from addiction to nicotine products. Throughout California, cities have adopted data-driven approaches towards the sales of flavored tobacco products. I fully support movements which promote healthy behavioral habits. Thank you for your continued efforts to promoting a healthy breathing environment. Sincerely, Assembly Member Chris Holden, 41st Assembly District. Dear Mayor Mahmood and members of the Council, the American Cancer Society Cancer Action Network, ACS-CAN, is committed to protecting the health and well-being of the residents of South Pasadena through evidence-based policy and legislative solutions designed to eliminate cancer as a major health problem. ACS-CAN supports efforts to reduce youth tobacco use and eliminating the sale of flavored tobacco products as an important part of a comprehensive approach to preventing youth from ever beginning a deadly addiction to tobacco. We support your efforts in eliminating the sale of all flavored tobacco products, including menthol cigarettes and hookah, within the city of South Pasadena and without exemptions. Smoking remains the leading preventable cause of death in the U.S. The 2014 U.S. Surgeon General's report found that more than 43 million Americans still smoke. It is estimated that tobacco use will cause 480,000 deaths this year in the U.S. Both opponents of smoking and purveyors of cigarettes have long recognized the significance of adolescence as the period during which smoking behaviors are typically developed. National data show that about 95% of adult tobacco users begin smoking before the age of 21, and most begin with a flavored product. In 2009, Congress prohibited the sale of cigarettes with flavors other than tobacco or menthol. Tobacco companies responded by expanding the types of non-cigarette tobacco products they offer, and now make most of those products available in a growing array of kid-friendly flavors. Sincerely, Primo J. Castro, Director, Government Relations, American Cancer Society Cancer Action Network. Press release: Pediatricians in support of South Pasadena tobacco sales ban, Los Angeles, California, October 16, 2021. Pediatricians support tobacco bans and urge the city of South Pasadena to pass a new ordinance to prohibit the sale of all tobacco products and applaud both Manhattan Beach and Beverly Hills for already taking this step to protect the health of children. The evidence is clear that tobacco products are detrimental to the health and well-being of children and adolescents. Tobacco smoke exposure harms children from conception onward, either causing or exacerbating the risks of preterm birth, congenital malformations, stillbirth, sudden infant death, childhood obesity, behavior problems, neurocognitive deficits, wheezing, more severe asthma, more severe bronchiolitis, pneumonia, middle ear infection, reduced lung functioning, and cancer. https://pediatrics.aap.publications.org/content/136/5/998 closing parenthesis. According to a 2014 U.S. Surgeon General's report, if we continue on our current trajectory, 5.6 million children alive today who are younger than 18 years of age will die prematurely as a result of smoking. Accessibility to tobacco products harms adolescents. A 2012 Surgeon General's report found that nearly 90% of tobacco-dependent adults initiated their tobacco use well before their 18th birthday. Moreover, nicotine has been documented to be detrimental to the developing brains of children and adolescents. Tobacco harms children. Smoke-free legislation and bans on flavored tobacco are steps towards protecting children and adolescents from the harmful effects of tobacco smoke exposure and consumption. But we need to do more. AAP Southern California Chapter 2, AAPCA 2.
That was the end of the last public comment.
Okay, and do we have anybody else that's present on Zoom that wants to make a public comment that wasn't able to make one before? I don't see any hand raised, but I did want to give that opportunity before we moved on. Not seeing any hand raised on my end, so okay, thank you for your time and all the thoughtful public comments. Let's bring this back to discussion with the commission, starting with, and I'm just going to go across my screen here, Commissioner Watson.
I appreciate everybody's comments, but I have no questions at this moment.
Okay, thank you. Commissioner Ding.
I don't have any questions. I don't think it was mentioned before, but the city does have a outdoor smoking ban on the books already, which might be useful for context.
Okay, thank you. Commissioner Kung.
I also appreciate everyone that made a comment today. I also don't have additional questions. Thanks.
And Commissioner Angelatz.
Thank you to everyone who came and shared their perspectives, and particularly those who provided either personal experience or research. It really helps inform our approach. Thank you. No further questions.
And yeah, I agree. Thank you for all the perspectives and the information. I know that based on the draft ordinance and updates that we've seen today, I can be in support of the ordinance as written. And I do thank staff for making the changes that the commissioners requested the last time we reviewed the ordinance, including but not limited to the updates regarding the details for the hardship exemption. Unless we've got any follow-up discussion by my fellow commissioners, do we have a motion? Okay, why don't I go ahead and make that? I'll make a motion. I move to endorse to the city council the proposed ordinance as written.
I second.
Okay, again, we're on virtual, so can we go ahead and have a roll call, please?
Commissioner Kung,
Yes.
Commissioner Watson,
Yes.
Commissioner Angelatz,
Yes.
Commissioner Ding,
No.
Vice Chair Cow.
Yes.
Motion passes.
Yes. Okay, thank you, everybody. Let's go ahead and move on to city council liaison communications. I believe I saw Councilmember on earlier. I'm not sure if he's still on now.
I don't see Councilmember Primuth is still on.
Okay, well, if he comes back on, we can circle back to him. Why don't we move on to staff liaison communications?
I'll go ahead and start first, and then welcome everybody and Happy New Year to all of you. I hope you're all healthy and safe. We have a lot going on this year, and I will let you know with the recent COVID surge, the city has gone to alternate work schedules. However, having said that, it still is not affecting our response, certainly with the police department. We have minimized our office staff, but that is not affecting our police response. So unfortunately, with the beginning of the year and like I said, the alternate work schedule, there's not a lot for me to report as of right now, which is good, which is a good thing in my world. So, but I'm happy to take any questions if anybody has anything. And seeing none, I will move it over to Chief Zaniston from the fire department.
Thank you, Chief Slinsky. And to second his concept of Happy New Year, and hope all you are doing well, especially during these times, which are so challenging with the COVID surge coming back. I can tell you anecdotally, having watched the board for the area in terms of responses, we did seem to peak within the last week, and I'm hoping that we're on the tail end of it. Our staff have been impacted by it, yet as Chief Slinsky said, we're still able to offer service. So we've had a few folks that tested positive, but we're coming back online with all of our staff bit by bit. So nothing further beyond that, and thank you for your time.
Okay, great, thank you. I don't see that Councilmember Prince is back, so let's go ahead and move on to commissioner comments or communications, starting with Commissioner Angelatz.
The only comment is to say that it was clear that the city was issuing a number of COVID-related reports over the past few weeks, changing staffing. I think adaptive leadership is the name of the game. Unfortunately, that, of course, surges tend to hit in healthcare, where I work, around the holiday winter season. So really a happy new year to all of you, and a huge note of appreciation for keeping city employees healthy and safe, and also your continued collaboration with the schools.
Thank you. Commissioner Kung.
Today, the students returned back to in-person school. There have been some adjustments made in recommendations towards masking. Besides wearing masks indoors, is also now required for outdoor as well, with exception of actively eating. And they also provide weekly COVID surveillance testing as well, and try to provide as much support and help for the students and the staff and the teachers as well. As of now, the after-school intramurals activities have been suspended, and volunteers are not permitted to volunteer on campus until, right now, they say after February 4th. So I think we're just evaluating and seeing how things go. And so far, like I said before in the previous meeting, there hasn't been any transmission within, on the campus at schools, but we'll see how things go this time around. So that's about it. Thank you everyone for your support.
Thank you. Commissioner Ding.
I don't have anything, just Happy New Year to everyone. And thank you for all the public comments and staff for all their hard work.
Okay, thanks. Commissioner Watson.
No comments at this time.
Okay, and I just wanted to make a quick note that this will likely be my last commission meeting because my term has come to an end, and I'm actually going to be welcoming a new family member early next month. So I think they'll take me out of pocket for just a bit. But it has been an honor and pleasure to serve on the commission with my fellow commissioners. I think we've done some good work over the few years that I've been part of this, and I know that you will continue to do great work. And I'm glad to have been able to serve our community with you. I also wanted to thank Chief Selinsky, Chief Sanderson, and staff for all the hard work you've put in. I know it's not always easy, but we do appreciate it. Other than that, have a great year to everybody, and I look forward to seeing you in the community and working with you in the future. And unless we've got anything else, let's go ahead and adjourn at 9:30. Thank you, everybody.
Thank you. Congratulations.
Thank you.
Congratulations and thank you. Happy New Year.
Thank you. Happy New Year, everybody.
Congratulations. Take care.
Thank you.